Hey, you've decided to have a breast augmentation. We want to fill you in on a couple of the things you should be thinking about when you're making that kind of a decision.
Once you decide to have breast augmentation surgery, there's a lot of decisions that come with it. One of the early decisions is whether or not you want to have silicone implants or saline implants. We wanted to spend a little bit of time talking about that today.
Basically, the two fillings, silicone or saline, in my mind, differ because if a saline implant ruptures, it's kind of like getting a flat tire. It's easy to know that it's happened, and the solution is typically that we take out the old implant and we put in a new one. With a silicone gel implant, it's sometimes harder to know that it's ruptured because the gel tends to stick to itself. So if there's a rupture, the gel kind of either stays inside the shell of the implant or may come out of the shell of the implant. If enough gel comes out of the shell of the implant, it tends to get encapsulated in scar tissue and forms a lump in your breast called a silicone granuloma that is hard and painless. And that typically is a good sign to most women that they need to go see a physician and be evaluated. And it's very quick to determine that it's not a breast cancer, but a ruptured implant, in which case the basic solution is that we take it out, we put a new one in for you anyway, just the same as we would if it had been saline.
So, how is it that you decide what is the right thing for you? Well, you have some values that you have to think about. Does it matter to you that there might be an implant that's broken that you don't know about, or do you want to know right away that something has happened? On the other hand, people who get silicone implants and with implants that are a little bit softer and a little bit more natural feeling. So, on that give and take of softness versus assuredness that everything is still intact, where do you land? Let's talk about implants. This is what a breast implant looks like. It has filling on the inside of it. It can be saline or silicone. They also have a certain shape to them as well. So this implant has a certain width to it, and it's got a certain height or projection, meaning that you can change the way that a breast is shaped by changing how big this implant is, how wide this implant is, or how tall it projects.
This is a good example. These two implants are different styles of implant. They're actually made by two different implant companies, but that's not what accounts for the difference in the shape. This one is larger, but it's wider and flatter, and this one is narrower and it's more projecting. So picking the implant is one of the more important things that happens in the consultation, and we will give you a lot of guidance in terms of deciding which one of these implants is right for you.
What actually happens in the consultation is you will be able to take a look, take a feel, and actually feel the real implants. You'll also be able to spend some time sizing, which means that if you bring clothes that you'd like to wear, bring a bra that you'd like to fill out, we have sizers that can help you decide how much volume you want. Once we know how much volume you want, we can find an implant that's the right shape for your body, the right width, the right height, so that you get the kind of result that you're looking for.
And this is why, if you're looking at pictures online of other breast augmentations done on other patients, it's very difficult to look and say, I want a 375 cc implant because it looked good on that patient. The question is not what looked good on that patient. The question is what's going to look good on you. And that's where taking into account what your soft tissues are like, the size of your chest, the width of your chest, the size of your breasts, the quality of the soft tissues tells us which implants to pick based on what your goals are.
Recovery after breast implants can really depend on a lot of things, starting from what it is that you're trying to get back to and exactly how your operation is performed and if it's performed along with other operations.
You know, there's been a lot of talk recently about getting back to activities quickly after breast augmentation. And the way that that is really done is to put the implant in a position so it is behind the breast and there's less disruption of the muscle, which is what has made people tender after breast augmentation historically. We have been doing a lot more breast augmentation in front of the pectoralis major muscle, but the issue is that for most patients, it really only takes about a week to feel good after a breast augmentation, whether the implant is placed in front of or behind the pectoralis major muscle. In fact, most of my patients after a week are back doing normal chores and things around the house. And after 2 weeks, I'm typically sending them back to the gym, even if we put the implant behind their pectoralis major muscle. Not everybody is a good candidate to have the implant placed in front of the pectoralis major muscle. And that may lead to a little bit more postoperative pain and discomfort and a little longer recovery time. We're looking forward to seeing you in the office. We hope that this video has helped you get oriented a little bit to breast augmentation, and we'll fill in all the details when we see you here.